Doesn't matter who tells you it is normal. I was like that. My mother was like that. If it's affecting you and if it's bothering you, then it's time for you to talk to someone about the possibility of endometriosis.
Hi, welcome to the channel. My name's Melissa, and today at Live UTI Free, we'll be talking about endometriosis and UTI. We have another fantastic guest with us, Dr. Shaheen Khazali, and in the first part of the interview, we'll be discussing what endometriosis is and its symptoms. If you're new to the channel, be sure to check out the description below as we've linked to some resources that you might find helpful. And lastly, if you enjoy these videos, think they're important, and want to support what we do, be sure to hit subscribe and check the bell so you'll be notified of any new videos we post. And other than that, thanks again for joining us on this journey to making change in women's health. Today with Dr. Shaheen Khazali, and we have collected a lot of questions from our community. So thank you so much for taking the time to share your expertise about endometriosis with us.
Thank you for having me.
I'd love to start with a little bit about your background, so you could tell us some more about how you came to specialize in endometriosis.
I've always found endometriosis fascinating, mostly because of how much we don't know about it. Mm-hmm. So I remember when I was training as a junior gynecologist, I always saw my trainers and my teachers sweat and struggle whenever they had to deal with endometriosis, and not just with surgery, with finding the right solution for the right patient. And I always like a challenge. I guess that was the start. And then I came across some people who I admired the works of, and it just got me interested in the field. And the rest is history.
Yeah. Well, so I think it would be helpful to start with some basic information about endometriosis. So the first one is, what is endometriosis according to the current understanding?
So the definition of endometriosis is when the tissue similar to the tissue that is supposed to line the inside of the womb, that's the endometrium, grows outside the uterus. That is called endometriosis. And endometriosis can cause lots of different symptoms that I'm sure we're going to cover. But generally speaking, the essence of endometriosis is the growth of this tissue outside the uterus, and it can be anywhere, and it can do lots of different things and cause lots of different types of problems.
Mm-hmm. How does endometriosis tissue differ from the endometrium in the uterus?
So there are lots of basic science research around that, and a lot of it I don't understand. But basically, it is not exactly the same tissue. It doesn't adhere to its surrounding structures with the same in the same way. It doesn't have the exact genetic structure. It doesn't have the exact receptors on it. But it's similar. It's too similar to be called anything else, mm-hmm. And it shares a lot of features with the endometrial tissue, with the gland-like tissue that grows inside the uterus.
Okay, can you explain what endometriomas are?
Endometriomas are any collection of endometriosis in a cyst-like fashion is called mm-hmm. endometrioma. In most of those cases, endometriomas are inside the ovaries. So endometriomas are also called chocolate cysts. And these are collections of, just to simplify, old blood that is usually found in ovaries. And oma basically is a collection of is a mass, basically. Mm-hmm. Endometrioma is a mass of endometriosis, which is often filled with dark, thick, chocolate-colored material. And right. Almost always we see it in the ovaries, but they can be found elsewhere as well.
Okay. And what is the current theory about why endometriosis occurs in the first place?
The current theory is we don't know.
Mm-hmm.
But our best guess is that it's a combination of different factors. And what complicates the matter even more is we don't even know for sure whether what we call endometriosis is one disease
Mm-hmm.
or different diseases that we just clumped together and called endometriosis. So the reason I say it complicates matters is that therefore these different diseases may have completely different pathophysiology.
Mm-hmm.
They may have different ways of forming. The oldest theory is what Sampson came up with in 1921, so that's 101 years ago. And it was to say that when you have retrograde menstruation, meaning blood coming out from the fallopian tubes instead of going out through the uterus, or at least some of it coming out through the fallopian tube, some of this can implant and can then grow into endometriosis. We don't think that can explain endometriosis, and we think that's probably too simplistic a theory. But since then, lots of different theories have been proposed. Some theories talk about the fact that endometriosis is just a deviation in the way that embryonic tissue has evolved, has changed. So, for example, you have a type of embryonic tissue that is supposed to become skin, another type that is supposed to become endometrium. And if some of these are frozen in their path to their target organ, in later life they can grow to become endometriosis. There are genetic theories, there are immunological theories, and the bottom line is the answer to most of your questions today could be we don't know, and I would be right in saying that, because although we have lots of different ideas and there's lots of good research that shows that some of these theories may be more a more suitable explanation, we still haven't got the final answer. And I think it's safe to say that the right answer may be a combination of all of these wrong answers. And who knows? We'll find out one day.
Hopefully. Is there any known association between endometriosis and the microbiome?
There are some suggestions. Again, microbiomes, environmental factors, and some other factors have been proposed, and they are certainly very interesting suggestions. Again, same. We haven't got the final answer, but there is some evidence to suggest relationship.
Okay. And can endometriosis only occur in people with female anatomy?
As far as I'm aware, you need to have XX chromosome for endometriosis to occur. There may be reports that I'm not aware of, but as far as I'm aware, yes, certainly all of the patients I've seen and treated have had an XX chromosome.
And you mentioned it can occur anywhere. In what parts of the body have you found endometriosis in your patients?
So I think this is worth exploring a little bit more, because to people who don't know endometriosis that well, or to patients who are worried about having endometriosis, this may sound really scary, maybe too scary, maybe unduly scary, that it can go everywhere. It can grow in brain, or in the eye, or in the nose. And for that reason, I think it's important to step back and look at numbers. The reality is 99% of endometriosis is seen in its usual places. And that is on the ovaries, in the pelvis, in the uterosacral ligaments, on the bowel, and on the appendix. These are the most common places for endometriosis. And then we have slightly less common areas, and that would be in the diaphragm or in the skin or in the rectus sheath. That's the body wall in the abdomen. And then we have very rare places for endometriosis. Some of them I've never seen. So, for example, endometriosis of the brain, I've heard about and I've seen reports of it, but I've not treated one or seen one. Keep in mind that I don't do anything other than endometriosis, and I was looking at my numbers. I believe I've done close to 4,000 surgeries for endometriosis. So multiply that by, I don't know, maybe 5 or 10. That's the number of patients I've seen with endometriosis. So they are very rare, and therefore, if you're diagnosed with endometriosis and also have headaches or have chest pain, the first thing that comes to mind shouldn't be, oh, it may be endometriosis of that organ. But with that in mind, endometriosis has been found in almost everywhere. But the most common areas that endometriosis grows are the ones that I mentioned in the first group: ovaries, bladder, peritoneum in general. So that's the lining of the inside of the abdomen. On the pelvic side walls, uterosacral ligaments, and then it can involve the surface of the bladder, or it can go deep in the bladder. It can involve the surface of the bowel, or go deep in the bowel. And then we have extrapelvic areas that I mentioned.
You just mentioned the deep in the bladder. Does that mean it's forming on the inside of the bladder or growing through from the outside?
It always grows from the outside.
Okay.
So it applies to bladder, ureter, and all these hollow structures and the bowel. That endometriosis grows from at the outside surface of that hollow organ and grows inwards, not the other way around, never the other way around.
That's good to know. There was also a question about adenomyosis and fibroids and what those are and whether they have an association with endometriosis.
Yes. Adenomyosis is when endometriosis grows inside the muscle of the uterus. So, and that is very much associated with endometriosis. In fact, in around 50% of patients with deep endometriosis, we also have adenomyosis. Fibroids is not directly associated with endometriosis, but it does have a common feature, and that is, like endometriosis, it is estrogen dependent. It's fed by estrogen, and therefore in some circumstances we see that the growth of one is associated with the growth of the other.
Okay, sure. Someone also asked about endometritis and whether there's an increased risk of this with the presence of endometriosis.
Not that I'm aware of. Endometritis, anything in medicine that has itis in the end means inflammation of. So endometritis is inflammation of the lining of the womb. And that usually happens for completely different reasons, not endometriosis related. I think perhaps I should take this opportunity to maybe explain something else that would be useful in all areas of medicine, but particularly in this area. There are associations and there are cause and effect relationship. These are very different things. So we know smoking causes lung cancer. That's a cause and effect. We have proven that it's much more likely for you to get lung cancer. I think it's 20 times or maybe more, I can't remember now, if you're a smoker, to have lung cancer. it doesn't mean that everyone with lung cancer is a smoker.
Right.
And it doesn't mean that everyone who smokes gets lung cancer. Okay, but they have a cause and effect relationship. With endometriosis, there are lots of different conditions that have been suggested to have some correlation, some association with it. But it doesn't mean that, for example, if you have an autoimmune disease, you're going to have endometriosis. And we have an interesting saying in research that if you torture data will confess, and that is a pointer to sometimes these associations are simply the result of over torturing a set of big data.
Right.
That we've looked at thousands and thousands of endometriosis patients, and then we've looked at different conditions that are a little bit more prevalent. And then when you analyze this, sometimes it can be statistically significantly different to the general population. And this kind of association needs to be interpreted with caution. So we need to sometimes, in some of these situations, take it with a pinch of salt.
Yeah, that makes sense. Let's move on to some of the symptoms. What are the most common symptoms of endometriosis?
So the three big ones are painful periods, painful sex, and painful defecation. So these are the ones that are typically and classically mentioned with endometriosis, but there are lots and lots of other symptoms that are typical for endometriosis. Bloating is one. Urinary symptoms is another one. All sorts of different urinary symptoms. Extreme tiredness is another one. Abnormal bleeding is another symptom that we see from time to time. Problems getting pregnant is another one, and it again comes in different shapes and forms. These are the main ones. These are the ones that we focus on. But of course, there are lots and lots of different ones, and there are different types of endometriosis growing in different organs, and those will have their own specific symptoms.
Okay, and do symptoms tend to differ depending on the patient's age?
We used to think that, but newer research shows that actually the type of symptoms people get are more or less steady over the course of 20, 30 years, which is very surprising. But from personal experience, yes, it can do. The type of endometriosis that presents in later side of reproductive age tends to be slightly different to the earlier age. We see more dyspareunia, at least it's my personal experience, that more dyspareunia in as the first complaint, maybe in a younger population than we see in the older population. In women who've had children, we see a different type of issue. The bleeding abnormalities tend to be a little bit more prominent in the latter end of the reproductive age.
Is it possible that endometriosis symptoms won't come on at all until you're in your 30s, 40s, or 50s?
Oh yeah, I just saw a patient with that exact description, that no problems at all until 44, and then suddenly significant symptoms. See, that's the issue with endometriosis, that it can do anything. It can behave in any way. There is always that core group that will present in a typical way, and they behave the way that the textbooks tell them to behave. But there are lots of outliers that would present in a strange way. One example is the severity of endometriosis doesn't really correspond with the severity of symptoms that much. Again, just at the risk of confusing your audience, that's also not completely true, because in most patients there is a correlation, but then there are lots of outliers where we have very superficial or very mild endometriosis and very significant pain. And then there is the other group where we have very severe endometriosis, but actually no pain. And this latter group is the dangerous one, because endometriosis can grow to affect the kidneys, affect the ureters, and because they have no symptoms at all, they may not seek help.
Yeah, and you mentioned that it can often appear on the bowel. I imagine that means a lot of people are diagnosed with things like IBS or other conditions. Are there conditions that are known to be kind of a misdiagnosis of endometriosis?
Yes, and that's another challenge, because a lot of endometriosis symptoms are the same or very similar to the symptoms of other common conditions. IBS is a good example. That, in fact, there was a research a few years ago that looked at people who have attended a gastrointestinal clinic with the diagnosis of IBS, and then looked at all the patients who are attending an endometriosis clinic, and then looked at how many of those have both diagnosis or interchangeable diagnosis. But that's for a good reason. Some of the symptoms are exactly the same. And even in patients who have confirmed diagnosis of endometriosis, we can't be 100% sure that that particular bowel symptom was endometriosis, because both IBS and endometriosis are very common. And therefore there are lots of patients who would have both, or would have a combination of both.
Is a diagnosis of IBS an indication that you maybe should check for endometriosis?
Not on its own, I would say. So if there are typical IBS symptoms that would then respond to typical IBS treatments, not necessarily. As a general rule, you should seek help for endometriosis if your symptoms are not responding to simple treatments, and if you are affected, your quality of life is affected by those symptoms.
Okay, you touched on this next question briefly, but I think it's worth highlighting. And the question is it possible to experience symptoms of endometriosis outside of the time that you're menstruating?
Oh, absolutely. Absolutely. Your period pain is only one presentation of endometriosis. You can have constant pain. So there are types of endometriosis pain that are actually not fluctuating with the cycle. Sometimes there are pains that start being cyclical and then become constant, and that's also the case there. And there are some pains that are cyclical but don't occur during the cycle. They can occur before the start of the period, for example, bloating being one of them that is worse in that part of the cycle. So yes, answering your question, yes, you can experience symptoms of endometriosis outside your period.
Okay, and is it possible to experience endometriosis symptoms pre-puberty or post-menopause?
Post-menopause, definitely. Pre-puberty, we know that you can find endometriosis in even newborns. But symptoms tend not to occur before puberty. Again, with endometriosis, there are exceptions, but it shouldn't be the top of the differential diagnosis. So if you have pain in an 8-year-old, endometriosis wouldn't be top of my differential diagnosis. I have never seen one before puberty.
Okay, and going back to the pain during menstruation question, at what level of pain should you see a clinician? At what level is the pain not normal?
Yes, when it's not normal for you. So different people have different pain thresholds. The bottom line is this normal for you? Is this affecting your quality of life? Is this pain stopping you from doing your normal activities? Is this pain stopping you from having sex? Is this pain stopping you from going to uni or, turning up to your work? And if the answer is yes, then it's not normal. It's not, doesn't matter who tells you it is normal. I was like that. My mother was like that, grow up and get on with it.
Yeah.
We hear that all the time. But if it's affecting you and if it's bothering you, then it's time for you to talk to someone about the possibility of endometriosis being the cause.
And what percentage of those with endometriosis are known to have fertility issues?
So we know the answer to the opposite question.
Okay.
We seem to think that around 50 to 60% of women with fertility issues have some endometriosis. Again, that's not necessarily a proof of cause and effect in those patients because they may have other factors for their fertility. But I think, again, it's very important to stress that having endometriosis doesn't equal fertility problems. Again, today I saw a lady who was really upset about the possibility of not being able to have children, even though there was even no diagnosis. She had pain and she was worried about not having children. And I explained to her that, look, first, we don't have a diagnosis. We're going to do 1, 2, 3 to get to the diagnosis. But even if we did have the diagnosis, it doesn't mean you can't have children. Most women with endometriosis will be able to have a completely normal fertility, a reproductive life. But it is true that endometriosis does affect fertility in different ways. And in some patients, very severe endometriosis in particular, it can mean that having children would not be possible.
Okay. And on the topic of hormones, is a hormonal imbalance likely to influence endometriosis, or vice versa? Can endometriosis cause a hormonal imbalance?
So this is a very challenging topic because it is full of things that we don't even have a good understanding of their definition. What is hormonal imbalance? Female physiology is much more complex than male physiology. And we definitely have not done as much as we should have to understand female physiology in the last 100, 200 years. And therefore, you have on one hand more complex physiology, and on the other hand, ignoring that physiology for 200 years. And therefore, we talk about hormonal imbalance. We don't even know what's normal for the hormone levels at that particular time of month. And hormones fluctuate all the time. So on an hourly basis, your hormone levels may be different. So that's the first complication. The second complication is we are understanding more and more about the fact that, again, endometriosis could be all sorts of different kind of tissues. For example, there was a recent paper on how some types of endometriosis are resistant to progesterones, for example. They don't have the right receptors. And therefore, when we use estrogen and progesterone at the same time, hoping that the progesterone component will subside, will suppress the endometriosis and counter the effect of the estrogen, we are just giving estrogen without being able to counter its effect. So all of that means that we need to hesitate before before coming up with a definitive answer about hormones and endometriosis, and how the imbalance may affect endometriosis, and how, as you said, the other way around, endometriosis could either generate its hormones or affect the levels of hormones in your body.
Okay. And when it comes to endometriosis on the urinary tract, what kind of symptoms might that cause?
That's another problem. You see, all this conversation has been about lots of problems and complexities that endometriosis has, which is what is fascinating about it. So a lot of patients with endometriosis of the urinary tract may have no symptoms at all, at least no symptom of urinary tract. So, for example, you can have endometriosis that affects your kidney, not directly the kidney, the ureter, and therefore the kidney, without any symptoms at all, zero. You have no blood in your urine, you have no flank pain, you have no difficulty urinating, everything can be completely normal. But in those who are symptomatic, you can get a range of different urinary symptoms. So you can get hematuria, blood in the urine. You can get frequency, needing to go and empty your bladder all the time, and you can get dysuria. You can get pain when urinating, and you can get that pain particularly when you are on your periods. Now, at some level, when endometriosis affects the ureters, you could start getting flank pains and kidney pains as well. But that actually is a very uncommon presentation of urinary tract endometriosis.
Okay. And then the pain after sex or pain during sex that you might get with endometriosis, could that be mistaken for UTI symptoms for people that have those kinds of symptoms after sex?
Yes, and they often are. So pain, the sort of pain you get after sex with endometriosis, and more commonly with adenomyosis, it has a different character. Usually it's a central pain, which is like a spasm. Urinary tract infection pain is different. You get burning sensation. You get a sensation of having glass shards in your urine, that kind of thing. So the type of character of pain is different, and that would come out in the history taking. But because common things are common, so getting UTI after sex is very common. It's easier to put that at the top of the differential diagnosis, and it's not actually wrong to put that at the top of the differential. Sometimes it's just a simple explanation, and it's important to rule those things out first.
Could the general inflammation caused by endometriosis make someone more susceptible to urinary tract infection?
That's a possibility, and that's something we don't understand as well as we should. There is some kind of relationship between the immune system, the inflammation, and endometriosis. And they can sometimes have a very complex relationship with each other. So in some situations, we know that if you reduce the inflammation in the pelvic area, you can reduce the pain. But we haven't proven whether that reduces the pain because the inflammation was the cause of the pain, or does that reduce the pain because reducing the inflammation reduces endometriosis pain.
Right.
And then add to the mix the immune system in general and the relationship endometriosis has with immune system. And then when you go look at the bigger picture, you have the issue of how nerves, which are responsible for carrying the pain signal, interact with all of these? Is it possible that our pain threshold changes because of presence of inflammation? Is it possible that the nerves fired in a different way during the periods? Is it possible? Because we know, for example, that even if you have a toothache, it will get worse during your periods. And that is nothing to do with endometriosis, but it is just the way that pain is perceived and the signals are transmitted to the brain with the change of hormones.
Thanks so much for watching. I hope you found this video helpful and pay particular attention to the section where we discussed endometriosis symptoms and diagnosis, particularly if you suspect you may have endometriosis. If you'd like to learn more about this or related topics, be sure to check out our other videos or head over to liveUTIfree.com for other resources. One really important article you'll find on our site is about lower urinary tract symptoms and how common certain conditions are. We'll also link to this article in the description below. Of course, if you like what we're doing with this channel, be sure to hit subscribe and check the bell so you'll be notified of our future videos. And until next time, keep asking questions and keep looking for better solutions.